We're going to go through some continence strategies for those that are suffering from incontinence. So we've done a couple of videos already on pelvic floor, gaining control of the pelvic floor, building endurance, and getting those fast twitch fibers working. Now, if you have been doing the work and you have been focusing on creating the subtle connection between the mind and the different parts of the pelvic floor, then you should be aware of where the external urethral sphincter is. I'm going to get my pelvis. One sec. If you don't know where your external urethral sphincter is, I'm going to show you using this pelvis. So when we turn the pelvis so that we're looking at the muscles on the front of the vagina, you can see there's a tiny little circle here, and that is the external urethral sphincter. And beneath this, we have a triangle of muscle and connective tissue here, and this is the urogenital diaphragm. So the external urethral sphincter is pretty critical when it comes to continence because it plays a role in the reflexes of urination. It's hard to just focus contraction on that one muscle. Typically, you contract this area kind of completely rather than just the muscle. But I encourage you to find that muscle on yourself, because when you think about where does the pee come out, I mean, we all know it comes out from somewhere down there. There is a little hole, but knowing exactly where that is and being able to feel that with your mind, they're not necessarily the same thing. So maybe what we're going to do is take a mirror. This is the one that I use when I do my little explorations. And if you put the mirror in front of you, you can strip down from the waist and actually position yourself so that you can see the full vagina. And if you feel here, you'll feel that you have a bone at the front, and that's this bone here, the pubic symphysis, and it goes quite far down, so you'll be able to feel where the bone goes. And if you look in the mirror at your naked vagina, you can't obviously see it through the clothes, what you'll find is that you have a tiny little muscle that you can see that's just in here. So it's just when you're lying back and things are coming up a little bit, you'll find it just here. So it's a little bit above the opening for the vagina. So take a look at it in the mirror and then put your finger on it and see if you can squeeze. Work a little bit on drawing the contraction to that area. It's very, very good also with the mirror to see whether or not you're lifting up when you're doing your contractions. So that's the first little bit of advice I would give you, is to see if you can find the center of contraction around your external urethral sphincter. Now, the next thing to note is that the external urethral sphincter plays a role in the reflexes for urination. So as your bladder starts to fill, there's little stretch receptors on the detrusor muscle. So the detrusor is the bladder muscle. And both the parasympathetic and the sympathetic nervous system are playing a role. So your parasympathetic nervous system is keeping the bladder relaxed, because when it contracts, it forces urine out. And your sympathetic nervous system is creating gentle increases in the pressure of the contraction on the external urethral sphincter as the pressure in the bladder increases. So it's physics. When your bladder is filling up and increasing in size, it's also increasing in pressure. And that external urethral sphincter needs to increase pressure so that that pressure is more than the pressure that's building in your bladder. And this makes sure that nothing comes out. If you cough or you sneeze or you do something sudden or you run or jump or any of these things, this is where stress incontinence happens, because the pressure from that cough or sneeze, if it is stronger than the pressure of the contraction that your external urethral sphincter is able to achieve, then you will leak urine. So with that in mind, we can talk a little bit about the guarding reflex. So the guarding reflex is this reflexive action that happens as the bladder is filling. So when your bladder is at about 250 milliliters, so about quarter full, well, maybe a little bit more than quarter full, this guarding reflex kicks in. And this is where your brain starts to send signals through the parasympathetic, your brain starts to send signals through the sympathetic nervous system to increase the contraction, while in the parasympathetic nervous system keeping the bladder relaxed. And this keeps going. Now, if you contract your external urethral sphincter, you're tapping into the guarding reflex. So there have been studies done that prove that contracting the external urethral sphincter creates the inhibition that you get in the guarding reflex. So if you're able to work on the contractions on the external urethral sphincter, then when you have that feeling that you need to go, if you stop, relax, contract the external urethral sphincter, hold that contraction for just a little moment, relax, contract it again, and just work a little bit on getting that contraction going. Your bladder will receive the signal to relax. Your parasympathetic nervous system will be getting the signals that it should relax. And that helps to create a little bit of control. Now, what is important to note is that as your bladder is filling, let's say you're going to the bathroom, just in case. So you go to the bathroom when you have only 250 milliliters in your bladder. What you're going to do is reprogram your reflexes so that your body believes that it's time to empty the bladder when it only has a small amount of urine. So if you pee just in case, you are creating dysfunction. So it's very, very important to make sure that you are drinking sufficient fluids and make sure that you're allowing your bladder to fill completely before you empty. Now, what you can do, if you've had, for example, a mesh removal, like I did, I was completely incontinent afterwards. And that meant that if I had to go to the bathroom, I would get up and go to walk, and as I would start walking, the urine just fell out of my body. There was nothing there, no way to stop it. It took a lot of work to actually get those muscles firing properly again. But I also had to retrain my bladder function. What I had been doing was going to the bathroom before leaving the house, going to the bathroom before going for a walk, going to the bathroom before doing anything, because I didn't want to leak. But that was just weakening my body's micturition reflex. It was stopping my body from functioning the way that it was supposed to. And by doing that, I was creating further dysfunction, creating the symptoms of an overactive bladder, giving myself mixed incontinence. So when I stopped and I started to really focus on trying to allow my bladder to fill, then I started to build a little bit more strength. Now, you get lots of free contractions when you allow your bladder to fill completely, because this guarding reflex is happening naturally. So think about it. If you can allow the bladder to fill all the way up, your brain is sending signals to increase that contraction on the external urethral sphincter. So you're getting these free contractions in if you allow the body to work as it is designed. So let yourself have those free contractions. If you find that it's very difficult to walk with a full bladder, so as the bladder is filling, try to sit while the bladder fills. Maybe watch TV and keep watching until you have a full bladder, and then get up and go to the bathroom. I did a lot of that. I worked from home. So when I was recovering from my incontinence, I was able to teach myself to go to a full bladder without having to move a lot, which allowed me to basically get used to the sensation of having a full bladder while I was working on building the strength in the external urethral sphincter to be able to hold it closed. It took maybe 6 or 8 weeks to retrain my bladder so that I could have a full bladder. And then what I had was pretty severe stress incontinence, and it took quite some time then, about 18 months in total, to go from being completely incontinent to being fully continent. But it's not something that happens overnight, and it's not something that you're going to be able to do all at once. But if you take all of these little things into consideration, you'll find that you start to create function. And yes, you'll have bad days, but you will have good days as well. And eventually the good days will outnumber the bad days. And if you keep at it and don't lose focus, you will regain continence. Now, the last thing that I'm going to talk about is what you can do when you need to deal with incontinence. So obviously there are pads, and these aren't any good for incontinence, these are little ones, but there are lots of pads on the market that you can use if you are leaking a lot. I know Tena have a full set of different options. Whatever you need to do to keep things right, you should do. You should be able to go out and move and do things while you work on regaining your continence. Now, there's also some other products. So when I was completely incontinent, I went to my doctor and he prescribed these. This is pretty much, I'm going to say, I have one that is opened. Now, I never used them because I was a little stubborn and a little determined to do it myself naturally. So after having plastic in my body, I didn't want to have to put anything else into my body. So aside from using pads, I actually didn't use any of these other things. But this is a pessary. So it's a little bit like a tampon, you see, and it's on a little string. And you get this little stick with it. And the idea is that you take this little tampon on the string, or this little pessary on the string, and you insert that into the vagina. So you take the string down. I don't know if you pull it, yeah, let's just hold it down. So you put it in like this into the vagina, and then when you let go, it pops out. And this, you put it in so that it pops out facing forward. And what this will do, it will create a little bit of an uplift around the neck of the bladder. So it's almost like it's providing a little bit of support to the urethra, but from within the vaginal passage. So this is a very effective way to give yourself a little bit of extra support if you need to go out and around. I mean, it is going to take, if you're completely incontinent, it is going to take time to regain continence. It's not going to happen overnight, and it's very, very easy to get disheartened. So do what you need to in order to be able to still live a normal life. Now, the other product this is quite recently on the market, and this one I haven't tried, but I will. Maybe I'll stick it on and go for a run one day just to give you some feedback on what I found. But let me open this and show you. So this, you can only buy these in the US, and I have a friend in the US who bought them and brought them over for me just so that I could see them and try them out. So it's basically like a little sticky pad. And if we take our little pelvis, you remove the sticky slip. This is maybe a waste of a sticky slip, and you stick it over the urethra. So this basically seals the hole closed, and there ain't nothing coming out if the hole is closed. So this is something that you can use. You can see that it's quite soft and pliable, and you can imagine that if the knickers are over that, it shouldn't really show. It's no different really to a wee set of lips, is it? So you shouldn't be able to see it through your clothes. It's quite soft, and it's quite sticky. Let's see if we stick it on the. Yeah, that's good. It's got a good grip. So that should be able to help as well. So I have a box of these. If anybody wants one, or if you want to try a few, just send me an email, and I'll stick a few in the post. So these are basically products that are available. The most important thing is that you don't lose heart. It's very, very disheartening to find yourself incontinent. It doesn't matter what age you are. It doesn't matter whether you're young or old. And, it doesn't matter how active you are. It can happen to anybody. And when you find yourself incontinent, it's very, very easy to take the option of having a quick fix surgery. And the consequences of the quick fix surgery, for me, were disastrous. I don't advise that you have surgery for incontinence. I advise that you work on building the strength. You work on teaching your bladder how to function properly. You learn to listen to the subtle messages that your body is giving you every day. Your body is craving function. It's always striving to achieve balance. And if you can just listen, you can give your body what it needs to bring everything back into balance.